Good morning, wound care peeps. It's Jenny Brewer. I'm back again with another segment on my channel for today's topic, which is Inadine. Inadine is a non-adherent, an iodine-based product that can be used on just about anything. I often tell people that when in doubt, put some Inadine on it. There are a couple fallacies about it. Often I hear nurses say that Inadine is something that dries out a wound. Inadine won't dry out an already wet wound, but it can help maintain something that is already wet. So again, because it's a non-adherent, it's a little bit sticky, and then over the period of about 3 days, you can leave this on, and the browny orange color that you see as the iodine releases into the wound makes the non-adherent turn to a whiter color. So it actually looks more like Adaptic. Adaptic is its sister product. Adaptic is basically Inadine without the iodine in it. Now, iodine, interestingly, is one of our better antimicrobials because the molecule of the iodine is the smallest, so we can actually penetrate through bacteria, sometimes even better than the silvers. However, it is one of these products that I think gets underrated. There's some research that in the past has shown that we have to monitor their TSH levels, that it can affect that. For the most part, that's been debunked. That's not really an issue unless it's severe long-term use or that it's actually being absorbed into bone. So it is a fairly safe product. You can cut it, you can pack it if you need to, and again, it doesn't dry out a wet wound. What we often do for those wounds is we're actually going to use pure betadine that comes in a bottle. Now, the iodoforbs that are in this aren't what your mother's was either. So back in the 60s, especially if you have older patients who are like, I don't want the iodine on. Well, there's not the same iodophores in it, nor is there the alcohol that was in our old iodine. So it actually is fairly safe to paint. It doesn't cause a lot of pain. We also carry ours in swabs. Sometimes the swab sticks are easier for painting. So if you're trying to dry out a wet wound, iodine is your choice, not Inadine. Inadine will actually just maintain the moisture. So with the betadine, what you're going to do is you're going to paint the eschar or the necrotic area, allow that to dry for about 5 minutes, and then paint it again. You do that 3 to 4 times. That's what's actually going to help create a crust, allow for the iodine to penetrate and kill any bacteria, but then it will help to dry out that eschar so we can maintain and keep a dry gangrene. Okay, hope that helped, that it was informative. Please like and subscribe. And I'm going to put a link to an article about iodine and the use of Inadine in the description box so that you can read up a little further on iodine-based products. Have a great day.